Welcome to the AAMDSIF Global Update on COVID-19. Thank you for joining us. My name is Alice Hauk, Senior Director of Health Professional Programs, and I'm introducing today's webinar. My colleague, Julie Powers, Senior Director of Patient Advocacy, will be moderating the questions and answers. As we get started, we recognize the generosity of Bristol-Myers Squibb and Acceleron for special support of our COVID-19 educational programs. We also acknowledge Bristol-Myers Squibb, Alexion Pharmaceuticals, Apellis, Jazz Pharmaceuticals, Agios, Genentech, and Takeda for their financial support for our 2020 webinar programming and the generous support of patients, families, and caregivers like you. With so many webinars, meetings, and conferences online, it's possible that you may lose your connection. If that happens, please refer to the confirmation email and try the link again or use the call-in number and passcode provided. We are also recording today's webinar, and it will be available on our website in 2 to 3 business days. You will be notified by email when it is ready for viewing. You are welcome to ask questions at any time during the panel discussion using the Q&A window at the bottom of your Zoom screen. Type your full question into the small text box window and press enter. Our panelists will do their best to respond to all questions. When submitting your questions, please submit your entire question at one time, and please do not share any private health information. Our panelists cannot answer specific questions related to your health. Today's panelists are Dr. Mikkael Sekeres, who is the new Chief of the Division of Hematology in the Department of Medicine and Physician Liaison in Hematology for the Sylvester Cancer Center in Miami, Florida. Previously, Dr. Sekeres was the Director of the Leukemia Program at the Cleveland Clinic Cancer Center and Vice Chair for Clinical Research at the Taussig Cancer Institute. Dr. Sekeres is also Chairman of the AAMDSIF Medical Advisory Board. He recently published a book titled, When Blood Breaks Down, Life Lessons from Leukemia. Dr. Valeria Santini is Associate Professor of Hematology at the University of Florence, Italy. Dr. Santini also serves on the AAMDSIF Medical Advisory Board and is an Executive Board member of the Italian Society of Hematology. Dr. Uwe Platzbecker is Director of the Medical Clinic and Polyclinic for Hematology and Cell Therapy at the University of Leipzig in Germany. Dr. Platzbecker also serves on the AAMDSIF Medical Advisory Board. Welcome to our panel members. Thank you for being with us today to give a global update on COVID-19. I'll turn it over to Dr. Sekeres to moderate the panel discussion.
Great, thank you so much, Alice. I'd like to welcome my colleagues, Dr. Santini from Italy and Dr. Platzbecker from Germany. Welcome, both of you.
Thank you.
Great pleasure seeing you.
It's pretty amazing that we're able to get this sort of representation from around the world to talk about this, this horrible pandemic that we've all been in. I think you can see from our backgrounds also, I think my colleagues are also calling from home. So if you hear some random voices or even my son practicing his saxophone, I hope you'll understand. We're all in trying times right now. We wanted to circle back in talking about COVID-19 in the setting of having a bone marrow failure condition, because things have changed in real time this year, and our knowledge and recommendations have changed also in real time from the very beginning when we held our very first webinar on this topic. We're in the midst of a third surge right now, at least in the US, where the prevalence of COVID-19 infections has unfortunately never been higher. But we're a little smarter in how we think about it and in how we manage our patients who have COVID-19. We hope that that's some of the explanation for why the death rates relative to the number of people who have COVID-19 have decreased somewhat. There are, at least in the United States, there are states that have been incredibly different in what they've been recommending for policies on business openings and social distancing guidelines. Our recommendation on behalf of the Aplastic Anemia and MDS Foundation is to remain extremely cautious and to practice social distancing. There are also a lot of studies that have been published on how people with various conditions fare if they unfortunately contract the COVID-19 infection. Our best interpretation of the data is that patients who have bone marrow failure conditions, patients who have cancer, are at particular risk of having poor outcomes if they contract COVID-19. And by poor outcomes, we mean stays in intensive care units where people may wind up on ventilators, or even, unfortunately, death. So we urge you to continue practicing social distancing, frequent hand washing and sanitizing, wearing masks around others, and encouraging others to wear masks around you. Next slide, please. Okay, so what can you do with this? You can do some of the same things that we're doing. You see us at home. And the reason is that if we can avoid going out, we are avoiding going out. In my family, we've reduced the number of times we go to a grocery store back to once per week because we're in the midst of a surge and we're trying to do everything we can to prevent exposing others to us and prevent others' exposure to us. We still recommend precautions that you all are well familiar with, because these are the same precautions we recommend for people who have compromised immune systems. The main path for viral infection is through eyes, nose, mouth, with hands that have recently been exposed to the virus itself. So continue to practice those precautions. If you do find that you've touched some surface that may be contaminated, wash your hands, use something that will sanitize them. If you do cough or sneeze and don't happen to have a mask on, to cover your mouth and nose with the tissue, and then wash your hands immediately afterwards. Avoid shaking hands with others, contact with others, and try to avoid close contact with people who are sick, and discourage anyone who has even mild symptoms from visiting your home. So when we started this pandemic, there was a lot of attention on surfaces and on avoiding touching surfaces that may be contaminated. What we've learned through this is that's not as great a source as the virus being aerosolized as we first thought. So even Dr. Fauci in the US has said that he no longer wipes down all of his groceries when he brings them home. He takes them out of the grocery bag that he carries them in, throws away the bag, lets them sit for 24 hours, and immediately washes his hands after unloading his groceries. I think that's actually really good advice. So within my house, we had established a safe zone in our garage where we unloaded all of our groceries and wiped them down. We no longer do that, but we do let them sit for 24 hours and wash our hands after returning from the grocery store. When you're out and about, keep kind of the same precautions that you've always kept if you have an immune system that isn't functioning normally. And that is that you're always conscious of when you've touched something and need to wash your hands or sterilize your hands afterwards. So I do recommend that you still maintain those precautions. I do it. I think I'm a little overly conservative about it. I will tell you though, every day that I go into work, I do wipe down the door handles leading into my office and my desk and keyboard on the inside, because I know there are probably some environmental services folks who've been in a previous night. Next slide. As I mentioned, clean touched objects and surfaces. Remember, flat surfaces are always your enemy. That's where germs can accumulate. And so you want to, if you touch one of those, you want to wash your hands afterwards. If you're in a high traffic area, you want to make sure you're wiping down doorknobs and flat surfaces. We're continuing to tell people to avoid travel. Most of the data that I've read has said that airplanes themselves are pretty safe. There was a Department of Defense study in the US that talked about the transmissibility of people with viral infections on an airplane, and actually was quite low. If you absolutely have to travel on an airplane, our recommendation is that you wear an N95 mask. If you don't have an N95 mask, then we recommend surgical masks. You can even wear a couple of surgical masks. I've also heard people who take a Kleenex and fold it up on the inside of that mask to provide an extra layer of protection, and wear goggles to prevent eye transmission. wipe down seats and armrests when you get onto the plane. But your biggest point of danger is actually not on the plane itself. It's probably in the airport beforehand. So make sure you're constantly washing your hands or sanitizing them when you're going through security, after you've handled luggage, after you've had contact with anybody. And then don't wait in the chairs by the gate. Don't wait next to people. And when they call your rows to go in, maintain 6 feet of distance between yourself and the person next to you. Always, always, always wear a mask. Avoid crowds and large gatherings, as we've mentioned, and the high-touch surfaces, as I've already discussed. If you have any particular questions, do consult your physician's office for what their recommendations are, because remember, these recommendations are changing even week by week as more and more data come in. Know where to get COVID-19 testing, and keep in mind that test results may not come back for a few days. My mom was symptomatic, and she lives in Rhode Island in the United States. We encouraged her to contact her doctor's office. She finally got a test, and it took 5 days for that test to come back. For her, it did come back positive. Luckily, she was through the worst of the cold by that point, but during that time, she had to isolate. So remember, even if you do get tested, you need to, as soon as you think you need to get tested, you need to quarantine and stay away from other people. If you do have a fever, we always recommend acetaminophen over ibuprofen because of ibuprofen's antiplatelet effects for those people who have low platelet counts. Next slide. We do have a message that's particular for patients who've received immunosuppressive therapy, such as ATG, antithymocyte globulin. And a lot of questions that have come into us are about whether people should continue to get their regular treatments. As far as we know, hospitals have become much better and outpatient clinics much more savvy about protections that they need to put in place so that you're safe and your healthcare providers are safe. We do recommend that you keep your regularly scheduled appointments. Some of those may be virtual and some not, and that you do continue to receive your regular therapy. Because yes, COVID-19 is scary. Some people who have bone marrow failure conditions, that's also quite serious and perhaps more serious than COVID-19. And we repeat a lot of times on these slides, always, always, always wear your mask. Continue to adhere to neutropenic precautions as they're recommended by your provider. In some cases, there are some medicines that have run low. If possible, try to get a 3-month supply of your medicine in case that happens again. I haven't heard a lot of stories about that though, so it's not a cause for alarm. Remember about quarantining. If you develop symptoms, if people around you develop symptoms, you've been in contact with someone, you may need to quarantine, so make sure you have the supplies you need to last you for 14 days if that happens. Next slide. And here's where you can get more information from the CDC, FDA, NIH, WHO, and the American Society of Hematology. And still more information. Of course, the Aplastic Anemia and MDS Foundation is a trusted advisor for this. So I want to turn to my colleagues for a second. This is my perspective from the United States. I'm curious if those are similar recommendations that you're hearing in Italy, Dr. Santini, or in Germany, Dr. Platzbecker. Dr. Santini?
Yes, absolutely. We give exactly the same information as you have just shown in the few slides you showed now. I think that our patients with MDS and aplastic anemia are patients who are sort of trained in keeping distance and being very aware of the risk of getting any infection. So they would just keep a little bit more the attitude they usually have. You know, in Italy, we have been hit by a very aggressive first outbreak of the virus. So our patients are especially aware and scared of the virus. So that in the beginning we had a very, I would say, we were extremely worried. But as a matter of fact, we had less infected MDS and aplastic anemia patients than we thought. Although I have to stress what you and reiterate what you already said, the patients who unfortunately got infected and got the COVID-19 were very seriously infected. And we had a very high rate of, unfortunately, severe infection and even a very high percentage of death. So I think that everything you said is extremely important. And I would add, do not under-evaluate any symptom that could be, in fact, and don't trust your family members or your friends. I mean, in the sense, trust them, but don't trust that they are not infected, because they could be asymptomatic. And with all the love they have for you, that would be anyway a great risk.
Thank you, Dr. Santini. Dr. Platzbecker, how are things in Germany?
Yeah, I would actually say that the things are basically superimposable to what Valeria and you just mentioned. I think social distancing is what we recommend, especially to our vulnerable patients with aplastic anemia and MDS. What we do in our department is that every patient with aplastic anemia or MDS being admitted to the hospital is preemptively checked for COVID. So even asymptomatic patients are checked before they are admitted by antigen testing. This is just a precaution because, as Valeria just mentioned, these patients with AA and MDS are, of course, one of the weakest with regards to the immune system and quite vulnerable to the infection. So this is a special precaution we have adopted at our side. But I think in general, especially Mikkael, what you mentioned in your introduction is valid, especially to our patient. I think it's valid to every human being at the moment being exposed to the COVID crisis. But I think our patients with AAMDS are especially should be especially committed to the rules or to the recommendations you mentioned.
Thank you. And Dr. Santini, in Italy, what are the recommendations around what types of symptoms should people be concerned about and put themselves on precautions or separate themselves from a family member or friend who has those symptoms?
Now in Italy, we have a system that if you had a contact with a positive person or a suspect contact, you are put under observation. That means that every day you get a telephone call from the health system and they ask you several symptoms. And they ask you whether you have, of course, fever, if you have a cough, or if you have if you are sneezing, or if you have a diarrhea, or if you have muscle ache, or if you have a bone ache, so that you may have a wide range of symptoms that could be heralding the disease, or could be a sign of disease. They are very similar to the symptoms you have during normal influenza, during the seasonal flu. So it's difficult to judge only by symptoms whether you have COVID or you have a flu. So that's why the majority, well, all our patients got the anti-influenza vaccination, the seasonal vaccination, but nevertheless, we ask for any symptoms. And I would say that all the patients that come to the hospital, even for the daycare to get treatment, all of them are periodically checked for COVID-19. So they get the test every time, 48 hours before they start treatment, and then before any treatment. So even if they are asymptomatic. So.
I'm really happy you brought up the flu, because that's a frequent question that I receive also. We have routinely vaccinated all of our patients for the flu. and there are a couple of reasons to do that. Obviously, nobody wants to get the flu either, because that can be quite serious. But secondly, what I think what a lot of people don't think about is that the same labs that are testing for COVID are testing for flu. So we're trying to prevent those labs from getting overwhelmed with tests so that it doesn't take 5 days like it did with my mom for a test result to come back, and her test result was positive, right? So of course we were advising her to quarantine. In that time though, she didn't know whether she was positive or not, was tempted to go out, at which point she would have infected other people. The other reason I'm really glad you brought up the flu is that it's the same route of transmission for the flu as it is for COVID. So if somebody has symptoms that could be the flu, maybe it is the flu, that means that person was exposed to a virus, another virus, just as they could have been exposed to COVID-19. The second aspect of that, though, is that you just don't know. So you have to assume that everything is COVID-19. I was just following patients on the inpatient service the past couple of weeks, and we had a few who popped positive for COVID whom we thought had maybe a bacterial infection or some other kind of infection. So we're ready to dismiss it. I think that's a really important point, to not dismiss something just because it has symptoms of another infection.
Yeah.
Dr. Platzbecker, I'm curious, what are the initial treatments that you're giving for patients who are positive for COVID-19 in Germany?
Well, first of all, these patients are, of course, not an immunosuppressed. Let's talk about patients not being immunosuppressed. I think if symptoms are mild, they need to quarantine at home and are not admitted to hospital. Of course, every immunosuppressed patient would be immediately admitted to hospital and isolated on a very dedicated and specific ward only for patients with COVID-19. And of course, as you mentioned already, the COVID-specific drugs are rare, although there are some limited evidence, I would say, from randomized studies that some drugs may be beneficial, but it is not like a black and white situation, and therefore I think very intensive supportive care is I think mandatory, especially at the very early beginning. And what we are facing now here at least in my hospital, is that patients now in the second wave come with at the very beginning with severe fatigue. So basically they don't eat, they don't drink, they're just in the bed, and well, they basically are really taken by the infection, and therefore I think very early supportive care, intensive supportive care, maybe parental feeding, something which may help them not to lose weight, I think is important at the very early phase. If the COVID situation becomes more severe with a kind of inflammatory response, and of course also then progressive lung infiltrates, dexamethasone is, at least I can only speak now for Germany and my side, I think it may vary, is the preferred treatment of choice to really cool down the inflammation, because we know, or we have learned also from preclinical models, that the inflammation actually also in the endothelial and vascular system drives also the lung disease, and may sometimes lead to irreversible changes also in the lung tissue and also other organs. So I think this is just in brief maybe how we approach the COVID here. But coming back now to the AAMDS, and of course to our immunosuppressed patients, they are of course special, and special in a sense that sometimes supportive care also may mean to substitute immunoglobulins, which sometimes are lower than compared to let's say healthy, otherwise healthy patients. And of course also the management of drugs around the disease-specific treatment, for instance cyclosporin or azacitidine in MDS. I think this is the challenge, how to continue, how to delay, how to dose reduce, And this is, of course, can only be decided on a case-by-case discussion.
You're muted.
Thank you. Another casualty of COVID.
I finished.
Those are really great points, Dr. Platzbecker. It sounds like your management is pretty similar to ours. So if somebody has symptoms but doesn't yet require oxygen, we're telling those folks to stay at home. Once they require oxygen, then they're coming into the hospital, and then we're at least making a decision about whether they go to a COVID specialty unit or come to our leukemia and bone marrow failure floor for management there. Our threshold for starting medicines is once someone starts to require oxygen, they're given a dose of steroids, dexamethasone, and continued on that to tamper down the inflammation, like you said. Our patients are also started on remdesivir at that point. And these are not miracle drugs. Can we just be honest about that? None of these drugs has completely cured people of COVID. We've seen some improvements in number of patients who go to intensive care units. We've had some shortening of duration of hospitalization, but even remdesivir, which is probably the best of these, has not shown a survival advantage over people not getting remdesivir. So they're, like you said, they're conservative. They help manage symptoms. They don't eliminate the virus. Dr. Santini, is it in Italy? Is it the management similar or does it differ?
Absolutely. Very, very superimposable, very similar. And you know what I want to stress is that the management is heterogeneous because patients and the how the disease is present in the different patients is very heterogeneous. So we have to face the fact that this virus is attacking persons and patients in a different way. And even if you are an immune depressed patient, you may react differently from another who has the same disease, and you may think that will respond in the same way. So it is quite unpredictable, I would say. And another thing we should be aware of is that the symptoms can appear and worsen in a few hours. So we never have to underestimate the fact of not being so symptomatic in the beginning, especially for our patients. I will just warn them to listen to themselves and take care of any changement in symptoms. So what we add also for, especially for our patients, is antibiotics and antibiotic therapy, just in case they would have a superimposed bacterial infection, especially lung infection. But otherwise, exactly what you said.
It's a great point, is that we don't assume it's just COVID particularly among people who have immune systems that are low. It could be another life-threatening infection. So we tend to be broad in our thinking of how we treat that.
Yeah.
I'm curious, Dr. Santini, we just passed a major American holiday, Thanksgiving, where I got a lot of questions about patients seeing family members. We have a more international holiday coming up in Christmas or Kwanzaa or even Hanukkah next week. What are you advising your patients about getting together with family members? Is there a way that they can do that safely?
You know, first of all, I must say that in Italy there are rules and laws about that. So you are not allowed to travel at all, and your restaurants will be closed for Christmas and the other festivities. And the only people who live together can spend the holidays together, and there'll probably be a little bit more of flexibility for elderly members of families. So if a grandmother or grandfather lives alone, they will probably be allowed to be with the family. But we are very scared and very strict. So our government has put some rules, strict rules, that may be flexible, but not so much. And what I would say generally is that it's so beautiful to be all together in a family, but we can do it later. I mean, I know holidays alone are really sad, but on the other hand, if you risk too much, then you will be sorry afterwards. So we need to hug. We don't hug since months, so it's terrible, really terrible. And I have a family with several elderly members, and I'm thinking of how to deal with it. But I'm sure that eating together is very dangerous, because you do not wear a mask. You are talking with loud voice. This is another high risk. You are laughing. You tend to hug your dear ones. And I think this is a very dangerous situation. So as much as we can, we should refrain from gathering together as much as we can. I mean, I know that it's not nice to say, and it's not a merry period for us, for all of us.
Yeah, that's very nicely stated. For all of us, we're suffering right along with our patients, and even the contact. I mean, different doctors act differently around their patients, but for those of us who hug our patients, we haven't been able to do that either. And we have also compromised, as you mentioned, with the many elderly members of your family. You're not going to be seeing them, and we aren't seeing ours either. Dr. Platzbecker, what are your recommendations for people getting together for Christmas? Is there a safe way that they can do it?
I mean, there are several, let's say, in German we would say several hearts in my soul. This is what we mean by, I think that there are, of course, there's no one answer. I think we are all affected, also ourselves as doctors, affected very much by also the emotional crisis this COVID crisis brought over us. I mean, we have a lot of stress, more stress than I think we had before. We are exposed also to the patients. We want to help our patients, and we are also exposed to the stress, let's say, around our social environment, and I think this makes it not easy. And on the other side, we see the finishing line of the COVID crisis. I think we can see it now. I'm not saying it's there, and I'm not saying March everything will be fine, but the finishing line is approaching us, and this makes it tricky and makes it, I think, very individual to decide when is social distancing mandatory and when is, I mean, Christmas or you mentioned other also US specific holidays like Thanksgiving, I think are very emotionally also affected or taken by the community, and therefore I think they are still in a reduced format and maybe in a selected format. They are also important for some people and for especially maybe also for some communities in order to keep the resilience to overcome or to basically stay alert and be able to actually go through this crisis until the finishing line is there. And therefore, my recommendation, or what we recommend and what we do, for instance, in our hospital, nobody can visit any patient anymore, so it's not allowed. You can't. No family members can visit patients. There's completely visiting stop, but we still allow it on an individual basis, for instance, and that's what I meant. If the mental health is really severely affected by social distancing, I think it is also for the sake of the patient health. It's very important to see at least a selected amount of family members in a selected and very protected environment. And I don't have a very good solution, but I think the solution may be to talk to your doctor, to talk to also to the doctor of the affected family members, and maybe design a kind of scenario where you can meet in a safe environment. One way, of course, is to do a pre-testing, and of course you never should meet anybody who has symptoms being in principle aligning with COVID, but of course in asymptomatic cases you may think about a test in all members of the putative meeting. But of course, as I said, I think we all should do social distancing, and I think we should not meet, especially foreign people. We should not meet in large groups. We should not meet in small rooms with no windows open. We should not meet for more than 2 hours. We should not sing together in a choir. I mean, these are very simple messages, but I think the point I want to make is that some patients, and not only patients, everybody in the community is sometimes affected by the decreasing resilience, also emotional resilience, to go through this crisis. And in these cases, talk to your doctor, talk to the environment. I think it's sometimes needed to meet, not in the old fashioned like hugging and let's say the way we were saying hello to each other before COVID, but just to exchange words, to see the eyes, to just to feel the other person. And even this is our experience with the patients, when we let the partners or the family, just one member in the hospital, just 15 minutes of exposure to the friend, to the family member is actually enough to, let's say, recharge batteries and to make them stronger to go through this.
It's really nicely stated. I get the sense from my colleagues, and I hope people tuning into this recognize, we hate being the bad cops for this. We hate having to give the tough message about staying away from family. It's affecting us just as much. But what we hate more is when our patients get so awfully sick from COVID-19. So I promise our gloomy recommendations are born in a place of 4 hearts, as Dr. Platzbecker said, where we care so much about our patients, we don't want to lose them. So one final question to both of you, then we'll open it up to questions from folks who've tuned in. We have some good news finally about vaccines. We have the first vaccine that's been approved in the UK, and in the US, the Pfizer vaccine is going to be considered by the FDA on December 10th and the Moderna one on December 17th. So when the vaccine becomes available, are you going to take it, and are you going to recommend it for your patients? Dr. Santini?
If the health authorities, the European health authorities, approve a vaccine, I suppose that they have passed through serious examination. Therefore, I would just give for granted that these vaccines are safe. And therefore, I would for sure encourage patients to be vaccinated, as much as I do for the flu vaccine.
Okay. Dr. Platzbecker?
Yeah, I think it's. I think the answer to this question is not easy, and it's not simple. And of course, first of all, in the European Union, we have. I mean, Great Britain does not belong to the European Union by January 1st anymore, but they have approved already one COVID vaccine now, and the other 2 are actually just at the moment assessed by EMA. So would I personally vaccine myself? Yes, 100%. And even if some people may say that the long-term data, also safety data, may not be as mature as maybe in previous assessments, which I at the moment cannot say because I haven't seen the portfolio and I haven't seen the applications. But my expectation is that if EMA or FDA approves a vaccine, that these are, I think are done in a way that these vaccines are safe, efficient, and can be actually given to every person in the respective country. So therefore, also in Germany, there's a tremendous discussion at the moment whether vaccination should become mandatory. And of course, nobody will do that. It is still your own decision, and everybody can do it or actually can decide not to get the vaccination. From a doctor, hematologist point of view, I would recommend everybody to get the vaccination, also to finish this crisis now, and to also protect maybe other patients who may get transferred the virus by potentially asymptomatic patients.
And I'll round this out by saying the data that I've seen so far from Pfizer and Moderna look very encouraging. As you've both stated, the long-term follow-up is limited. So the 95% efficacy we've seen is based on a 28 days of follow-up following the actual shot and how many people got COVID-19. The follow-up press release we've seen is that patients who got the vaccine who did get COVID-19 had very mild cases. That's also encouraging that there's some efficacy of the vaccine. So I and my family, based on the data we've seen so far, which is not a full disclosure of data, are going to take the vaccine. I'll be clear about that. For my patients, I am going to recommend it. I think the most important thing to look for in the vaccine is to make sure that depending on what country you're in, that you receive a vaccine that is not live. So my understanding is that the mRNA vaccines from Pfizer and Moderna are not live. Therefore, they would be safe for people who have bone marrow failure conditions. You want to avoid any vaccine that's live, however, in the setting of a compromised immune system. So we'll open it up now to questions. Maybe we'll take turns answering.
Thank you so much, Dr. Sekeres, Dr. Santini, and Dr. Platzbecker. We have a number of questions, most of which were related to the vaccines. So I think you answered most of them, but I'll go through and just double check those. But first, we have several questions about precautions that patients can take in their home. First question is, do home air sanitizers help?
It's a great question. I don't see either of my colleagues jockeying to try to answer it either, so I'll try. The HEPA filters are supposed to help. That's the big deal that's on airplanes, and why at least the Department of Defense study showed that airplanes are pretty safe. But you should not be, the keys to avoiding this are time and distance. The more time you spend with someone, the closer you are to a person, the more likely you're to catch COVID-19. You want to avoid indoor spaces. Time and time and time again, it's the indoor spaces that have been the place where people have caught this. So I think the filters help. If it's a HEPA filter, I do think it helps a bit, but it shouldn't be an excuse to get together with someone outside of your immediate family, the people you live with, nor should it ever be an excuse to be in an enclosed space with somebody who is not masked.
Thank you.
I may add a word on this. Please open the windows.
Yes.
Open the windows as much as you can, regularly and every 2 hours. That's something very important. You shouldn't forget about it. It's winter. I know it can be difficult, but it's very important to change the air in the rooms.
I thank you for adding that, Dr. Santini. It's a great point. I have a patient who really wants to spend Christmas with her grandchildren. And I didn't even have to say, you can't do that. She knew. And she said to me, how about if I open up all the windows in my living room, we all wear masks, I don't serve any food, so everyone has to be masked, and I only spend half an hour watching them open presents. Is that okay? And I thought to myself, you know what? I think that's okay. But that's a pretty extreme way of dealing with it. But the point about open windows is huge.
But it's correct.
Yep.
Thank you both. Our next question comes from an MDS patient whose spouse has other compromised comorbid conditions, including an immunosuppressed condition. This patient does most of the shopping for everyday needs. They wear a mask every time. Do they need to change the mask in each shopping venue, or can they reuse it?
Dr. Platzbecker?
Yeah, I think, are we talking about the surgical mask here or about the other one? I think about surgical, isn't it? That's what I mean.
Give both answers. What if it's surgical and what if it's cloth?
Well, the surgical mask, of course, is a mask which is considered for one operation. I mean, let's say if you are in the operating room, you can use it and you breathe like you do. You breathe like 2 or 6 or 8 hours, and that's considered to be safe. So if you use this kind of surgical mask the entire day, I would not recommend to reuse it actually another day or a third day. So I would basically use another one. If you now consider different shops, or if you are at a shopping tour and you're just changing malls or whatever, I think it's not the mall which defines whether you have to change. I think it's the time you are in the mall or the time you are shopping. So I would say this kind of surgical mask is valid and is okay to use for an entire day without change. Of course, if you have saliva, or if something, if it's getting wet, if it's getting too wet, the mask, of course, then it needs to be changed, because then it's no longer protective for you. But as long as it stays dry and nothing like that happened, I think you can use it for one day. For the other mask, well, I think they are more robust and can be used for several days. I'm not aware, maybe my colleagues are aware of data or recommendations for the more, let's say, more sophisticated masks. I have no recommendation and no experience with that.
So what I've read, I think what you just said about surgical masks is great. And these surgical masks, if they get any kind of even tiny holes, they're no longer effective. Some of them also have some sort of electrostatic coating that helps trap germs, and that can get worn away. So that's why you really want to limit the use of them. The cloth masks have now, there are some studies that have come out that say they just simply don't work as well as surgical masks. So there was widespread enthusiasm for any type of mask when this first started, because people weren't wearing masks at all. So that's why you had government authorities like the Centers for Disease Control in the United States saying that cloth masks are okay, because the approach was any mask is okay, better than nothing. Now studies have come out showing the cloth masks really don't work as well as the surgical masks. So, and particularly the ones you see like the football coaches wear, where it's like a scarf that they pull up, that's supposed to be terrible. So surgical masks are preferred. If you have to wear a cloth mask, then the recommendation is you wash it every time you use it to keep it clean. But the recommendations are going against cloth masks even.
Thank you. Our next question comes from patients who are continuing to take cyclosporine. Do you believe that may provide some protection from severe COVID symptoms should they get the virus?
Dr. Santini? What if we instead of limiting it to just cyclosporin, what if it's patients who are on cyclosporin or prednisone?
You know, in a certain way, yes, because you suppose that with this therapy, you will not get the immune system so strong, and you will not have a reaction to the virus that is sometimes very defining the gravity and the seriousness of the infection. On the other hand, being immunosuppressed can expose you to other infections together and together with COVID, and this may lead to a very serious condition. So even if you do not have a severe immune reaction to the virus, you may have exposure to other infections. So I think it's a double-sided situation. So you should be very careful anyway in considering yourself protected from a serious COVID infection in this way. I wouldn't say so. I wouldn't really trust that this is keeping you safer, let's say.
Thank you. Our next question comes from a parent of a pediatric patient who has had a successful bone marrow transplant and is 3 years post-transplant. They want to know if it will be safe for their child to get the vaccine and then return to school.
Boy, that's a toughie. I don't take care of pediatric patients, so I'm going to start off with that caveat. I would think that at 3 years post-transplant, your child's immune system should be competent again. And if your child is already receiving other scheduled vaccines, then your child can get this vaccine. The safety of returning to school, boy, it's a landmine, and I don't know what the right answer is, and I struggle with this with my own kids. My kids are both virtual right now. We did let my youngest go back to school when that was available, but it was only for a week before they shut down again. Kids don't get this as bad as adults, but kids can be carriers. I don't have great advice for the school part of this. In terms of the vaccine, if your child's getting other vaccines, then your child can get this vaccine. Dr. Santini, Platzbecker, do you have any more input on this? It's a tough question.
It is, but there is a lot of discussion on whether kids should be back in school early or not. And there are not so many cases in kids, but there are. And some of them have developed a serious disease, very rare in comparison to adult population. Still, we cannot exclude the risk, and we cannot exclude, as you mentioned, that they are carriers. So it's very difficult to reply to this question.
Thank you. Our next question comes from a patient who wants to know if it's safe to be in an office space where people don't normally wear masks, but you are. The people in the office will put on a mask when you're there. Is it safe to return to an office setting, either in a professional capacity or as a visitor?
Dr. Platzbecker, you want to take this one?
Well, I think it's also the previous question is really hard to take in this and to answer appropriately in this forum. I think therefore, I agree with Dr. Sekeres. I think we have to be cautious, and with all caveats this platform comes along with, because we don't know the situation, we don't know the patient's conditions, the age, we don't know comorbidities. We really have only a limited input in this forum. But I think what I would say from my standpoint here now in Germany, that in all offices in Germany, also my hospital, everywhere, masks are mandatory at the moment. So everybody, being sick, being old, being young, whatever, is wearing a mask. For, you may say, for good reasons. Yes, I think this is, it's not only the protection, but it's also the awareness. And if everybody wears a mask, this is just resulting in awareness and caution against the other person, against the neighbor, and so on. So if that's not the case in your office, which I understood from the question, that only you are wearing a mask and the others are not, then of course the question is, what kind of office is it? Is it a large office? Are there windows? Are you opening the windows from time to time? What is the proximity to the next colleague? Is it more than 1.5 meters, or is it less? Can you get out of the office very easily? What is the access to fresh air? So I think these are all points. I mean, if you watch now sometimes the news and so on, people giving speeches if they can have a kind of distance at least 2 meters to others, they sometimes take the mask off and just give speeches or just talk. But I think in an office like this, in a let's say closed environment, I don't think that this is safe at the moment. So my suggestion, and again, this is a very simplified way of seeing things, maybe from very far away, is to talk to your colleagues who actually, I think you are very close with, whether they would take the responsibility also and wear a mask all the time when you are at least in the proximity to them. So let's say the surrounding 5 or 6 colleagues, just as a measure to protect you, being obviously more vulnerable than the others from a potential COVID infection. Again, this is with all caveats, but I think the COVID crisis also showed us that we need to take responsibility, not only for us, but also for the others. And so I think sometimes it helps to talk to people, to talk to neighbors, to talk to in a very open-minded and not aggressive way, just asking for support and asking for help in protecting yourself. I think this would be my recommendation.
Thank you. As you can imagine, most of our questions are specific to various patient conditions related to vaccines. Doctors, what recommendation or what thought process or decision process should patients and their treating hematologists and oncologists go through as they determine what is the best vaccine option for them?
I can get started. I don't think we're going to have much of a choice. The government has already contracted, at least the US government, and I think the same is true in Europe, with specific manufacturers if their trial results are successful. So we're going to get the Moderna or the Pfizer vaccines in the US first. I don't think we're going to get one that these vaccines target the inside of the viruses. There are vaccines being developed that target the outside of the surface of the virus. I don't think we're going to get the outside virus vaccines here. What I would consider is what data are available. In general, vaccines are safe. What I'm hearing about these is people do get a decent local reaction, so swelling and redness and pain where they got the injection itself. You may get some symptoms from it, kind of like when you get a flu vaccine. And when you have a vaccine that's in a 40,000 patient study, as some of these are, you're always going to get some minor bad things that happen to people that you're not sure are related to the vaccine. That is true of flu vaccines. That's true of the measles, mumps, rubella, of tetanus, of any vaccine that's out there. So I wouldn't let that be an obstacle to getting the vaccine. If you hear about the one person who had a bad outcome, to me, that's not enough to prevent getting the vaccine. Everything I've seen from these, at least in short-term follow-up, is that they seem to be pretty safe. And we'll know more next week when it's actually formally debated at the FDA. Dr. Santini, Platzbecker, any comments on this?
As Dr. Platzbecker already mentioned, in Europe, the health authorities are discussing the vaccines. And when we will get the approval and after they have been examined, we will have more data to share with our patients. What I think is scaring the patient is, and everybody, I suppose, or even not patient, is the fact that these vaccines have been developed so quickly, or better, they are not known. So the measles vaccine or the flu, we know since a long time and we trust it. These ones are new, and therefore maybe the perception of the persons and the non-medical persons, it's different from the others. But I suppose that then when they will come available, as I mentioned before, they will be decently studied and approved and therefore safe.
Thank you so much. for that response. We have a few more questions, but I want to try and wrap it up fairly quickly. So, but I will just have, we have one more pediatric question to get to, which is a pediatric patient with aplastic anemia just finally completed their treatment and is being weaned off cyclosporin, but is being monitored and is on Promacta. They have not yet been able to receive age-appropriate vaccines. Could they receive the COVID vaccine?
Again, none of us, I don't think Dr. Santini or Platzbecker treat kids. So it's going to be hard for us to answer this question. I think that if it's a non-live vaccine, it probably wouldn't be harmful to the child. I think the question and the reason the child hasn't received other vaccines is because you don't know if it'll take either, if it'll work. Because for vaccines to work, you need one portion of the immune system has to be competent, and given those treatments, that child's immune system may not be competent enough for vaccines to work.
Thank you. Our last question is, are there best practices that ER physicians can reference when treating patients with COVID who present in the ER? For example, where would they find that information? Doctors in the ER haven't seen our rare diseases. So if a patient has COVID or thinks they have COVID who's experiencing those symptoms, would you recommend they not only go to the ER, but also call their treating hematologist or oncologist as well?
So if I'm understanding the question, it's that ER docs aren't as savvy with bone marrow failure conditions. So are they the best people to make decisions about treatment of COVID, or should it be a dual input that includes a hematologist? Is that correct, Julie?
Yes, thank you, Dr. Sekeres. That's correct.
My opinion on that would be to involve both, because a hematologist will have input about the compromised immune system that an ER doc may not be aware of. The ER doc is probably more savvy at treating COVID, and this is where you really need collaborative care.
Thank you so much. Thank you, Dr. Sekeres. Thank you, Dr. Santini and Dr. Platzbecker for sharing your time and expertise with us, especially during this very, very challenging time. This webinar will be available in a recorded format on our website in 2 to 3 business days, and we'll send you an email letting you know that it's available. We will continue to provide you with updates on COVID-19 and answer questions as quickly as possible. However, we do strongly recommend that you reach out to your treating hematologist or oncologist. If we weren't able to get to your question today, you can go ahead and send it to us to an email at help@aamds.org. Call our hotline, our helpline at 800-747-2820 extension 2, or submit a question to us via our Facebook page. On behalf of the Aplastic Anemia and MDS International Foundation, thank you for joining us today and making us your resource of choice for information on bone marrow failure disease. The AAMDSIF Medical Advisory Board and team are here to help you and your family, as we have for the past 36 years. This concludes today's webinar. Thank you all so much.
Thank you.
Thank you. Goodbye.